This was the old surgery center. It's since been remodeled, completely gutted, and we're starting all the way back up. They've sheetrocked this side down here. This is the west side. So for any of you guys that have walked through from public health, right on the other side of that wall, down in that door, is that glass hallway that you walk around. And when we kind of move around this side and you look down this hallway, you'll see a lot of plywood down there. That's actually the tunnel that a handful of you guys have walked through in order to get the public health back over here. We'll work around into the new addition, and the new addition is much further along. We have all our sheetrock on. Guys are working, they're starting to come right flowing through into here, and then we'll continue on with getting sheetrock up in this space. So about 2 weeks from now, this whole area will be white with sheetrock, and guys will be working above the ceilings. This is our new addition. This is all new construction. Ties into public health over here on the far wall, and ties into what the old surgery center was over there. Like I said, anything that has a window is an exam room. Anything that doesn't, or has a window is an office. Anything that doesn't have a window is an exam room. This will give you a better feel for what the public space will look like, where nurse workstations are. This wall, there'll be casework and countertops between these. This wall, there'll be casework along this as well. So it's a very wide space. After you put the casework in there and you put a couple chairs and you get people working, it narrows down a little bit to more of a standard hallway feel. There's a couple of bays along this wall. There's 3 of them, and there's one at the end. They're also nurse workstations, again, full height windows. A lot of casework goes into this project. A lot of finishes will go into this project.
Workers within the clinic, you're going to see pharmacists at some point in time in the clinic. And so that model sort of allows for a workspace for them because of the occupancy. So, and I think in this model, so if, and this would be a great problem, but if we outgrew the space, the way that this is set up is you could push it that way and add additional pods. Essentially, you're extending those hallways. And I think there's some transitions. You know, Cody referred to this as kind of the public area. It's public for purposes of the staff, but there'll be some transitions, headers, and otherwise that essentially say, if you're a patient, that's your area, and you know you probably should.
Yeah, patients will be allowed back here.
Yeah, so from a confidentiality standpoint, in the current spaces, if you're a patient, you walk right into the middle of that. I mean, there's computer screens that are facing you, so I think from a confidentiality standpoint, this will be much better, much more efficient. I think lots of opportunity for teamwork. Yeah, it's just going to be a much more flexible space.
The old surgery area and the ED reception, the area where Sonia's office is, all was on one very large airhead. It's been a big problem over the years. It fed the old surgery suites. So through this project, we decided to replace that with 2 smaller units, give us a little bit more redundancy. One unit will be on this new construction, and it will serve just the clinic. The other unit will be, it's right over what is the business office today, and that will serve all of the 95 construction other than this clinic.
New construction is easy. You know, the remodel stuff, especially when you get into old buildings, it's like there's not always current drawings, and you end up tearing into something and going, man, there's an I-beam there that wasn't on the drawing, whatever the case might be. But part of this, which will be a significant challenge, so the sprinkler system, because we added such a significant addition, other parts of the hospital that weren't sprinkled, the fire marshal said, hey, because you're spending money, spend a little more money and sprinkle the rest of the hospital that's required. So if you can imagine, these guys are going to have to figure out how to sprinkle an emergency department that's fully functioning. So it's like, you know, shutting a room down at a time, running piping through the room, and that's for a significant portion of, a really, really old portion of the hospital, including our offices and otherwise. So anyway, lots of coordination and you know, I appreciate both of these guys working on that.
And so when you look at this project and you look at everything that goes into it, it's local guys that are here in town, Spencer, Iowa, Sioux City, Iowa, Esterville, Iowa, Spirit Lake, Iowa, that are working on this project to create this for this community. So it's not just Journey here helping these guys. You know, we're just a small part of the project. It's all of these guys that actually put the work into place that make the difference.